Welcome, students. This is Shelley Ohms, your instructor for the summer course for CNA at John A. Logan College 2020. I am starting with Unit 1, which is Introduction to Healthcare. You will notice that we are doing 14 units, but the units do not necessarily correlate with the chapters. Unit 1 is actually parts of chapters 1, 2, 3, 22, and 28 in your textbook. So it's important for you to look at the required reading to know what's included in the unit. Objectives are for Unit 1, purpose and services of healthcare facilities, person-directed care, interdisciplinary team, role of the nursing assistant, professional and ethical behaviors, competency standards for nursing assistant practice, scope of practice, charting, documentation, and the nursing process. Functions of healthcare settings. We have long-term care facilities, which are included in your nursing homes, your assisted living, and your independent living. Skilled care is a term you will hear often in long-term care facilities. That just means that that resident requires care from a nurse or a therapist. Hospitals are for acute care. It's for patients that require care that cannot be given outside. I don't know what I meant to write there. But yeah, when you go to the hospital, you don't plan to stay there. Home health aides take care of people in their home. It's similar to a CNA, but they also may do some cleaning, shopping, laundry, and cooking. Adult daycares are held during certain hours while the family is working or unavailable. So we live in a time where we have what's called a sandwich generation, where people are still raising their own children and also having to take care of their aging parents. So they can't necessarily quit work because they're raising children to take care of their parents. So that's where the adult daycares come into play. Rehabilitation is to improve or restore function after illness or injury. Hospice care is compassionate care for those with less than 6 months to live, somebody who has a terminal illness. Nurse assistant role, the main roles are you're going to be measuring vital signs and helping with activities of daily living. So vital signs include temperature, pulse, respiration, blood pressure, and pain assessment. ADLs include bathing, caring for skin, fingernails, and hair, caring for mouth and teeth, dressing and undressing, walking, transferring, making beds, and helping with elimination and or toileting needs. Methods of nursing care. We have team nursing, where the RN is the team leader and everyone reports to the team leader. We have primary nursing, where the nurse provides much of the care. This is sometimes seen like an intensive care unit where they may only have 1 or 2 patients and they do everything for the patient, including what a CNA would do. No, they don't always have a CNA there. Functional nursing is where you are assigned specific tasks. So when you go in, you may be assigned, you're going to do the vital signs on everybody today, or you're going to do all the daily weights. So you're going to do the all the dressing changes, treatments, showers, etc. That's functional nursing. Long-term care promotes person-centered or person-directed care. Their goals are to recognize and develop the residents' capabilities, promote individual preferences, choices, dignity, and interest, respect background, culture, language, beliefs, and traditions, improve the quality of life of residents, and enhance their control over their own care. Holistic care refers to treating the whole person. So our goal is to meet all of their needs, their physical, social, emotional, intellectual, and spiritual needs. Interdisciplinary team is anyone who provides care to the resident. It comes from various disciplines, which would be basically the different departments: nursing, dietary, physical therapy, occupational therapy, activities, social work, those kind of things. The resident, of course, is the most important member of the healthcare team. Chain of command. Chain of command is the order of authority within a facility. It helps protect from liability. So it tells you who you are to report issues and problems to. It's in place to keep people from going straight to the top of a facility. They should go to their immediate supervisor and move their way up the chain of command when they have a complaint. Liability is a legal term that means a person can be held legally responsible for harming someone, and this can happen a lot in healthcare. Standards for a CNA: appearance. Your positive first appearance is very important, and you always want to observe the dress code for your facility. Work ethic: CNAs must be dependable, trustworthy, enthusiastic, and accountable. Ethical behavior: ethics is knowing what's right and wrong and having and abiding by the standards of conduct. Examples of ethical behavior is to not accept tips or gifts. You're being paid for the service that you do. Keep all resident information confidential and do all your assigned tasks. Qualities: you must be an effective communicator, a team player, be positive and professional, and a resident advocate. This is a list of the nevers. As we had talked before, main roles are to help with activities of daily living and vital signs. That is what is in your scope of practice, is what they call it. Here are some things that we never do. There is a handout. I just went ahead and put the nevers on the slide, but you also have that handout to refer to too. Never give medications. Never insert tubes or objects into the body. Never take oral or phone orders from a doctor. Never perform procedures that require sterile technique. Never tell the person or the family the person's diagnosis or medical or surgical plan. Never diagnose or prescribe treatments or drugs for anyone. Never supervise others, including other nursing assistants, and never ignore an order or request to do something. These are the legal limits of the CNA role. Healthcare worker registry. This has to do with certification. So anyone can Google the healthcare worker registration for Illinois, and you can see every CNA on there that is practicing right now. So once you have completed the program, which means getting at least a 78% on the theory, 80% on clinical, and a 78% on your final exam, then you have completed an approved program. At that point, she would submit, Crystal, my boss, would submit your information to state so that you're eligible to sit for the state exam. The state exam is what certifies you. If you're going for recertification, you have to have worked as a CNA in the past 24 months. So that's important. If you want to renew it, you have to have worked. On the registry, they can find when your potential employers, you won't have a license to give them or anything like that. What they will do is they will look on the healthcare registry, and on the healthcare registry, they can see your name, your address, your phone number. I don't think they can see your social security number, but results of your background check, the name of the program and the day you completed it, date that you took your test. So if you take your test more than once and you fail it the first time, they can see that too. And also if there's ever been any investigations about the care that you have given regarding abuse or neglect, that would be on there too. Continuing education for CNAs, when you renew your certificate, you're going to have show proof of 12 hours of continuing education. Delegation is assigning a specific task to a specific person. So a nurse may delegate a job to you. The 5 rights of delegation, they have to make sure that they delegate the right task, under the right circumstances to the right person, give them the right direction and communication, and the right supervision and evaluation. So the task needs to be something that is in your scope of practice. It needs to be in the right circumstance. You may not be basically the right person to do the job. If you need direction or communication, they should help you and supervise you as needed. A care plan is a written plan for care of the resident. It includes their goals. Examples of things that would be included on the care plan would be their activity order. Do they walk up and down the hall? Are they wheelchair bound? Do they walk with a cane or walker? What kind of diet do they have? Is it regular? Do they need their food pureed? Those kind of things are all on a resident's care plan. Nurses use the nursing process to develop care plans. So if you go on into nursing, LPN and RN, you're going to hear a lot more about the nursing process, and you're going to have to develop your own care plans for residents. But basically, an assessment is done on the resident. A nursing diagnosis is given. They develop a plan for the resident, they implement the plan, and then they evaluate the plan. The care plan requires good communication between all members of the healthcare team or the interdisciplinary team. The CNA's role in a care plan, and your main job, you are the eyes and the ears. You are the one that spends the most time with the patients. You see their skin when you're helping bathe. You will notice changes in their mental status and their energy levels, things like that. So when you make those observations, that's your job, is to report that, and maybe that will end up with an update in their care plan. We have signs and symptoms. Signs are objective information, which means it's information based on what you can see, hear, touch, or smell. You can see a rash, you can hear a cough, you can touch the skin, feel like it's cool, clammy, warm. You can smell different odors. So those are things that you can see, hear, touch, smell. Symptoms fall under subjective information, which is something that the resident and their families report to you. If they report to you that they're in pain, they feel nauseated, those kind of things, those are subjective information. Observations that you need to be aware of is any changes in mental status, any changes in a resident's vital signs, in their ability, changes in appetite, toileting, and mood and skin. Observations that you must report immediately are shortness of breath, chest pain and pressure, pain in the calf of a leg, blurred vision, slurred speech, or bleeding. Vomiting, weakness or dizziness, abdominal pain, vital signs that are not normal, headache, or falls. Healthcare record. We have a chart. The chart is a legal record of the care. It's a written account of observations and care. It's confidential, and it can be written or on computer. Most nursing homes in our area still have a paper copy of the chart, but a lot of the actual charting is done on computer. Guidelines for charting. All information is confidential. Document immediately, and you should never record any care before it is given. Use black ink is usually the policy in most facilities. You're always going to sign your name and your title. Use the correct date and time. You should chart facts, not opinions. If you make a mistake, draw a single line through it, initial, and date it. You are not to erase, use correction fluid, or scratch anything out. Military time. This is just a graphic of military time. I can see on the blue is military time in the PM hours. The white is military time in AM hours, and then the orange is your standard clock. So there's a handout. It's just a practice handout for you to practice with military time. I know on your quiz you probably have 2 or 3 questions we'll have to convert to military time. And that's it for Unit 1. Thank you for listening.